Hi, I'm Ray Sievert with Tracey Technologies. We're giving pearls on how to get the best use of various displays in the iTrace software. Today we're going to look at the Toric Check. And many of you understand that the upper left box in the Toric Check is the measured astigmatism inside the eye. And you know that the middle box is the target axis or steep axis of the cornea after surgery based on topography. What some of you don't understand and don't fully appreciate is this lower left box is very important because it shows you two things. What is the current corneal power in astigmatism, how much astigmatism is on the cornea, and how much cylinder are you getting from inside the eye, the lens that you just implanted. And if these two don't match, or these two don't match, either one, you have a problem. Let's take a look at a couple of cases and try and learn some pearls along the way. Here you have a toric lens axis and target axis that's 8 degrees off. Now, is that significant? No. It might be with a big toric, but on a small toric, it only affects a quarter diopter. That's not enough to rotate. When you look at the box on the left, you see that the problem is that the patient's lens that you implanted is not strong enough to offset their cornea. So rotation is not the problem. It's that the lens choice you made was not strong enough. Here's another case. You see the toric lens and axis. The axis is way off. It's rotated 25 degrees. A point here now about the Tracey current refraction, where there's 4 diopters of astigmatism. We'll tell you by rotating the lens and optimizing the axis how much astigmatism you can affect. And we'll predict the post-rotation refraction. The point here is that the spherical equivalent remains the same. So not only do you alter the spherical amount, you alter the cylinder amount as well. And so it's important to look at this post-rotation refraction to see what you're actually going to get. And obviously in this case, it makes all the sense in the world. You need to rotate this. In case 4, you see a similar situation where there's a diopter and a half of astigmatism and a small rotation, 14 degrees, will fix all of it. And the resulting power after is actually quite good. So in this case, you're going to want to rotate the lens and it will solve the problem. In toric case 5, we have 2 diopters of astigmatism and a rotation of 17 degrees, which is a significant amount of being off, only fixes half of it. So when you look at the refraction after rotation, you'll still have a diopter of astigmatism. So the point is, you need to look at this and make a determination. If I rotate the lens and I still have 1 diopter of astigmatism, will the patient be satisfied or not? And that's of course up to you, a little bit having to do with the patient's personality type, expectations, etc. But you'll know before you see the patient, without dilating, whether or not the lens is optimized for axis location and if you've selected the right power. When you look at the power in the lower left, it's important to understand exactly what lens you put into the eye. And it's also important to understand that when you have a toric check and it tells you to rotate the lens and what you should expect to get, you will get something close to that when you rotate the lens. So make a mental note that when you're looking at the toric check, you're looking at the power of lens you put in. And if it's consistently off, the cage you're using or the calculation that you're using may be off. And you can work retrospectively to go back and look at what lens power and calculation would have given me a better result. So hope you enjoyed the iTrace pearls on the toric check. One last comment is you have to make sure you have very good corneal topography, or the toric check sometimes gives you a strange result. But if you have good topography with good tear film, then you can count on it. And when you dilate the lens should be where we told you it is, and the rotation should result in the refraction we've predicted.